Hey, so I thought I'd make another video about TOS. This one I kind of want to talk more about what it is and the different types of it, the treatment options, symptoms, those kind of things. My name is Nicole. I have thoracic outlet syndrome. I've had it for a long time. Right now I'm 37 years old. I have had extremely severe symptoms since about 2005 is when it started to set in. Like bad, like it was impeding my functioning on a daily basis. Um, Prior to that, I had symptoms probably since I was a teenager, minor symptoms, but there was definitely some stuff there looking back. Um, I have neurogenic thoracic outlet syndrome. Um, I was a competitive swimmer for many, many years. I swam through high school and college. Um, I swam breaststroke, which, especially in the 90s too, like late 90s, breaststroke was like super high, super tall, and like really hunched over. So I developed a lot of, my shoulders turned forward, my head posture was forward, my neck was always forward. I always had lots of pain, like in my up in here between my shoulder blades, constant, like just big knots. Nobody could ever work them out. And stiffness in my neck, and I get a lot of spasms. But when I was about 25, 26 years old, that's when it really started to become pretty pretty bad. I started to have increased pain, a lot of tiredness in my arms, and my symptoms. Not too long after I had a minor car accident, my symptoms then went from you know moderate to pretty severe. And out of the blue, I felt like out of the blue. It probably obviously wasn't out of the blue, but I started to have numbness and tingling and pain big time in both hands. I figured, oh, great, I got carpal tunnel now, but it turns out it wasn't. I didn't, it was a thoracic outlet syndrome. I would have a lot of, like, in addition to the pain, cramping, numbness, tingling in my hands, my neck was always very stiff. Like, if I turned my head to the side, it would just be like that was about it. And I couldn't at all like stand up straight. If I stood up straight, it was like something was pulling my neck back. Um, and it just got worse and worse over the years. And after about a year of the numbness in the hands, and to the point where it was starting to affect my life, I started to seek out treatment, which led to close to 10 years of basically test after test, procedure after procedure. Some doctors believing me, some doctors acting like I was faking. Basically, nobody diagnosing the problem. And, I had some doctors that tried really hard to help me, but it went on and on. So basically, there's thoracic outlet syndrome is a compression condition, and it's one of the reasons why there's not a whole lot of buy-in in the medical community is because it's a positional compression condition. So most people with it, when their arms are at their side or in some kind of neutral position where they're not compressing things, they don't have the symptoms, or the symptoms are a lot less. So with standard imaging and standard testing and nerve conduction studies and MRIs, when you're in a neutral position, nothing shows, and then everything looks normal, and then you get told it's all in your head, but it's not. So there's a few different types of thoracic outlet syndrome. Um, the most common type of it is neurogenic, TOS, and that's probably about 95% of people with TOS have neurogenic. Um, it's often looked at as a less serious type, but actually with neurogenic TOS, uh, the symptoms are pretty disabling, pretty debilitating, really bad quality of life. It tends to go many, many, many years undiagnosed, because there's nothing life threatening presenting like some of the other types. Um, so, there's neurogenic TOS. And I forgot to mention too, TOS basically is, there's a small rib underneath the collarbone called the first thoracic rib, and then there are muscles that attach to that. In the majority of the cases of TOS, the brachial plexus, which is the nerves, the nerve bundle, like it goes all the way down your arm, starts up here, goes down your arm into your hands. And also there's some pretty important blood vessels there. Veins and arteries run through there in a very tight space in between here. And TOS occurs when basically any of those structures get squished between the scalene muscles that run down here and the rib. Some people have an extra rib on C7, which is like one above the first thoracic rib, and cervical ribs. I believe it's about 10% of people have it, and they're not always symptomatic, but if you have a cervical rib in the presence of symptoms, that's pretty significant, and they can cause a lot of problems, particularly with some of the more dangerous types, and they can actually cause damage to the blood vessels. So those structures get compressed. They typically get compressed when your arms are up, when your arms are raised above your head, or when they're extended out. So anything overhead typically causes a ton of compression, or even just arms out, typing, that kind of stuff, driving, all that stuff starts to compress. And when you compress something, bad news. I mean, I think most people are pretty familiar with what carpal tunnel syndrome is, which is, when the nerve, the median nerve in the hand gets compressed in the carpal tunnel. The best comparison I can make for TOS is if you could imagine carpal tunnel of like your entire arm, but starting up here, where the nerve gets compressed, but also most of the time your veins and arteries get compressed as well. And it causes symptoms from here all the way on up, like up here, basically radiating down the arms. Very painful condition. So there's the neurogenic form of it. Then there's two other forms of it, the vascular types of it. There's venous thoracic outlet syndrome, and basically venous thoracic outlet syndrome is when, because of either some kind of abnormality, some kind of maybe an injury to the bone, or maybe like the rib is too big, or something, or even just like repeated movements and repeated compression actually cause damage to the vein. And when the vein becomes damaged, then what happens is blood clots form. And it's very serious. It needs to be treated. It's pretty urgent when that happens. You don't want to wait months to get that treated, because blood clots can be life-threatening. And that typically causes, like, out of the blue, like, your whole entire arm might swell and go purple. The other type, so I forgot to say too, the venous thoracic outlet syndrome, and the arterial type, those account for like less than 5% of cases of TOS. The venous is about 3 to 4% of TOS patients, and arterial, the third type, and the arterial type is pretty serious. That's pretty rare. That's about 1% of the cases, and that's when the artery itself, like usually the subclavian artery, gets damaged from like repeated friction, and then really bad stuff happens. You might get like damage to the artery, narrowing. You can get clots, you can get strokes, and you can even have like aneurysms and that kind of thing form. And so it's pretty serious. It is rare, but it does happen, and that's usually a medical emergency when that happens. Um, with neurogenic thoracic outlet syndrome, most patients with it have some degree of compression of the veins and arteries as well with neurogenic TOS, because it all runs through. The veins and arteries run right next to that nerve. So a lot of times it all gets squished, or maybe sometimes more of the artery gets squished, sometimes more of the vein. But the positional compression, like if when the vein and artery and nerves, like when they're positionally compressed, like that doesn't mean that you have the venous or the arterial TOS. It's different. It's just everything gets squished there, and it can cause a lot of symptoms. So with thoracic outlet syndrome, basically, who is at risk for that? Like I was a competitive swimmer, and that's a lot of repetitive overhead, upper body stuff. A lot of athletes are pretty prone to it, especially like overhead throwing athletes, the people that do rowing, gymnasts, baseball pitchers, big time, hockey sometimes. Anybody that has that does a lot of repetitive movements, a lot of people that are into that do a lot of computer work, that kind of stuff, that can all put you at risk for it. And the symptoms of TOS, that can vary too on the type of it, but so for neurogenic TOS, typically tons and tons of pain, lots of pain. I have a very high pain tolerance, and I was just in excruciating pain for years. Symptoms of that: lots of pain, radiating down the arms, numbness and tingling in the hands are a big one, and sometimes you can even get burning. A lot of times your arms get tired, your hands get tired. You can get cramping, like little twitches and stuff. My hands used to, if I used them too much, which depended on what I would do the rest of the day, but if I overdid it with my hands, or if I had to use them a little bit too much, I would get these spasms, like especially with this finger and this finger, they would just cramp up, and then sometimes my hand would just claw up, and it was done. It would be done for hours, and I couldn't use it if I tried until it decided to like not be compressed anymore. So you get the radiating pain down the arms. That's hallmark symptoms. You can have it on one side or you can have it on both sides. I have it on both sides. People that have it on one side, usually there's like some kind of abnormality there, or maybe they just do a lot of damage to one side. Some other symptoms, and the symptoms are worse when you are using your arms, when you're reaching out, when you're lifting. Some other symptoms are, in addition to the numbness, tingling, burning, cramping of your hands, pain in your hands. You can also get a lot of neck pain, a lot of pain like between your shoulder blades, all up in here too, because with the posture being so forward, those muscles in the back are just in constant tension trying to straighten out your posture. Not really successful at straightening out your posture, but they're trying constantly. You can a lot of times really cold hands all the time, like Raynaud's syndrome is very common with TOS. Some people lose their pulse when they raise their arms. Some people get like intermittent swelling or bulging of the veins in their hands too. So there's a ton of symptoms, and even with myself, mine had gotten so bad and so severe for so long that I started to have some pretty scary symptoms. Like if I turn my head like this or like this, I'd pass out, because I'd just lose all my it would cut off my blood flow so bad I'd just pass out. So that's bad. With people with TOS, usually constant pain, sleeping. I think none of us with it sleep, because you can't find a comfortable way to sleep ever. And it's horrible. The worst part about it is that we are not believed, because the standard test that a lot of the specialists will run, not TOS specialists, but maybe people go to like orthopedic doctors and that kind of thing, or spine doctors. Their standard tests don't show anything because of the positional nature of the compression. So in terms of testing, by the time anybody actually gets to an expert on TOS, either one, they've clotted out of the blue and had venous thoracic outlet syndrome, and it was a medical emergency, and then they got prompt treatment. And a lot of times, people with venous thoracic outlet syndrome, or even the arterial types, fare a lot better with surgery because they don't have the years and years and years of symptoms. So, that is at least good, because their outcomes are typically better if they get it surgically treated and treated well by somebody that knows what they are doing. But it shouldn't have to be that way. You shouldn't have to have a massive blood clot or almost die from something to get prompt treatment. With the neurogenic types, usually people that have it have gone years and years with symptoms, getting passed around from specialist to specialist, no answers. Usually, most of us, I think pretty much most people that I know with TOS have been misdiagnosed with fibromyalgia, or similar type things. But by the time we get to the specialists, a lot of imaging has been done already. A lot of testing have been done. So some testing. Okay. X-rays can tell you some things. X-rays can tell you if there's anything wrong with the bones, anything wrong with your ribs, if you've ever had a break, if you've had extra ribs. So X-rays can be useful, but most people with TOS don't have abnormalities in their ribs and their bones, but they can be useful. MRIs, by the time you get to an expert, doctor on TOS, you probably had all these tests. MRIs are often done, and MRIs can show, if anything's going on, if there's a lot of scar tissue, if there's any abnormalities. But what they don't show is basically if your arms are at your side, they're not going to show any compression. So often people will, when they're having these symptoms, the doctor will order them, and if there's nothing wrong with the cervical spine and there's no bulging or herniated discs and everything looks good, they'll say you're fine. But with TOS, again, it's positional compression, so it's not going to show anything with your arms at your side. Some things that can mimic TOS, carpal tunnel syndrome, double crush, like if people have maybe they have some kind of compression up here, like maybe a bulging disc and then carpal tunnel in the hand, so it causes the radiating pain. There's not too many things that can mimic it, but there are a few. And bulging discs too. If you have herniated or bulging discs in certain vertebrae, that can also cause some of the radiating pain down the arm. So an MRI is useful. You want to make sure you don't have that stuff, but you can also have some of those things and also have TOS as well. Because as we get older, our spines start to degenerate and our discs aren't always in the greatest of shape. But yeah. Okay, so another test that is commonly ordered is an EMG, which basically is to study the nerve. And that's the big one that basically keeps most of us from getting diagnosed for years. Because arms at your side, they're testing the nerve. The majority of the time, very rarely does it ever show any kind of nerve damage with TOS, unless it's gone on for years and years. Like right now, if mine went on for so long, I wound up with a ton of muscle atrophy in my hands. I would guarantee that if I had an EMG at this point, which I'm not going to because those things are awful, but I would guarantee if I had one, it would probably light up with some nerve damage. But that's just because I went untreated for an excessively long time with excessively severe symptoms. So the EMGs, people get them done, then doctors say you're fine. And if you ever have a doctor tell you that you don't have TOS because your EMG is negative, just run. They don't know what they're talking about. You have to get to people that know what they're doing, or it's just bad. So some other tests. So by the time you get to like, and you also want to make sure you want to rule out other health conditions as well. Like you might want to, get blood work, rheumatology panel, that kind of stuff, and rule out other conditions as well. That's important too. Okay, so by the time you get to somebody who specializes in TOS, there are some common tests that are done. But they'll do like physical exam. They'll examine you in positions that provoke the symptoms. One test that can be useful is like a multi-positional Doppler ultrasound. First, they check all your veins and arteries with your arms at your side to check for any abnormalities in your veins or arteries, to check for clots and that kind of thing. But then also what they do is they also check, they also do the scan with your arms above your head and in a few different positions, and look at the blood flow, and look if you're, if there's blood flow changes when you raise your arm and that kind of thing. Now, blood flow changes, and even sometimes when people put their hands over the head, a lot of us, pretty much most of us, lose our pulse when we put our hands over our head, people with TOS. But that can occur with people who don't have TOS as well. But it is another useful tool, in painting a picture for the diagnoses. Some other types of tests, diagnostic lidocaine injections are a big, they're a very good test for neurogenic TOS. Basically what they do is under imaging guidance, and this is very important to have imaging guidance because you're putting a needle pretty deep in some muscles, deeply into some muscles in your neck where there's a lot of important structures there. There's nerves, veins, and arteries all over there. But basically they inject lidocaine right into the muscle that is causing the compression, and they get your pain levels before, and then they wait until it kicks in, and then they check if you have pain relief immediately after, and then if that lasts for a while, that's considered a positive for neurogenic TOS, and that has really high reliability for confirming a diagnosis of TOS. It's over 90% reliable. And the other cool thing about that is, one, it confirms a diagnosis of TOS, but then it's also correlated with surgical outcomes. Like if you have a positive with this, there's a really high chance that the surgery is going to help you. So that's a cool thing. And a lot of times too, people get Botox put in as well, which serves as a few purposes. But the one purpose is like, it's almost like double confirmation of TOS, because then it actually relaxes the muscle. It takes a few weeks to kick in, but relaxes the muscle, causing the compression. And if you get relief with that, plus if you had the positive for the diagnostic lidocaine, it's even more evidence that surgery is going to be effective. And there's some other, I'm a patient at Johns Hopkins, so I'm most familiar with their protocol, but there are some other places that do some other types of imaging as well. Some places do these really cool, I think they're 4D CAT scans. I've never had one of these things, but they're pretty wild when you look at the imaging. Like, it looks like you can see like everything. You can see the nerves, you can see the bones. So there are some places that do those kind of imaging as well, and that can really pick out like if there's a lot of scar tissue or some abnormalities up in there, up in this area. So treatment for TOS, if caught really early, a lot of times conservative treatment can be helpful. I'm not sure how sold I am on whether physical therapy can cure TOS early, but I think if you caught it early enough, it could probably really help some stuff. A lot of times when it gets to the point where it's so severe that you have arterial compression, physical therapy it actually makes it worse, because when the artery gets compressed, when you stretch or when you raise your arms, like you have no blood flow in your arm, you can't really do anything. So physical therapy is usually tried first, and actually failure to physical therapy, I probably should have mentioned under the diagnostic process, that when people fail physical therapy, repeatedly, and when it makes it way worse all the time, and when you can't make any progress, or if you make like a little bit of progress and then you do one wrong move or one wrong thing, and then it sets you back 3 weeks, like that's also highly indicative of TOS. People with TOS usually can't be successful with physical therapy. And a lot of physical therapists, they are pretty good at actually detecting TOS, but a lot of them just don't know how to treat it either. So another conservative option is Botox, like I mentioned before, they put it in here. And Botox can help. There's a few different reasons for getting it. One, it's another confirmation of the diagnoses. Two, it can provide symptom relief, whether, you're just trying to put off surgery for a while, or whether you can't get surgery for a couple months, if you're trying to avoid surgery altogether too. Not everybody can, but it can be useful. You can put it off for years. So Botox can be useful. For me, it's not very short, or it's not very long lived for me. Any Botox injections I've ever had, for my TOS, I also have pec minor syndrome, which is similar compression, but it occurs with the pec minor, which attaches. It starts here, and then it attaches onto ribs 3, 4, and 5, and sometimes 2, 3, and 4. So that can also cause the same compression and almost identical symptoms, except they're a little bit like people with only pec minor syndrome tend not to have like the neck stuff, but about half of patients with TOS have pec minor syndrome anyways. Not everybody needs surgery for it, but at least half of us have it. So I've had multiple sets of injections, and it really only lasts about 3 to 4 weeks for me. But those 3 to 4 weeks are pretty nice when I've had them. Now I've been through 4 surgeries. I've had, and that leads me to the next thing I was going to talk about: surgery. Pretty much the most effective thing for TOS is surgery, and the surgery is absolutely brutal. They cut out the first thoracic rib, and then they either remove or like clip the scalenes off to alleviate the compression. Last summer I had both. I had it done about 8 weeks apart, my right and left side, because I'm bilateral, and oh boy, that's brutal. But it has changed my life beyond what I can explain. I mean, I could barely even function, and I have my life back, and it's great. And then about a few months after my surgery, I got really after my surgery, my posture, I had been so hunched forward that I actually, going into surgery, I was slightly under 5'5". And then after my rib resection surgery, I grew like an entire inch, because I can stand up so straight now. So I'm now a little over 5'6" now, which is really weird, being taller in a year, because I'm 37, I'm not growing anymore. But when I got taller, and my posture got straighter, I did have pec minor syndrome like for years with my TOS. It probably was like one of my first symptoms, like when I was a teenager, but my pec minor just couldn't hack it. Like it just couldn't even, like the taller I was, the more it stretched, and it just was like, nope. So I also had pec minor release in June. So I have 2 scars there from my pec minors being cut to alleviate additional compression, and that went pretty well. I'm still recovering from that surgery, but it's going pretty well. My God, for years I was in 8 to 9 out of 10 pain constantly, 24 hours a day for at least 10 years. And now I'm not cured from my TOS. I'll always have TOS. I would say my symptoms, I probably have about 80 to 90% pain relief, depending on what I do. Because there are things that still flare it up. But, I mean, it's, oh, God. I can't even explain what it's like to be out of pain. I mean, my pain is just very minor. And the funny thing is, like, my pain tolerance was so nuts before going into surgery. Like, yeah, it was, I had a pretty dangerously high pain tolerance, and now it's kind of normalizing a little bit. Like, I still have a very high pain tolerance, but it's not as nuts as it used to be. So yeah, it's kind of interesting too. And I was on Lyrica for 10 years, and I went off that in January as well. So things are pretty good. Like I don't need the Lyrica anymore. So I think, with surgery and with any TOS treatment, if you're having these symptoms that I described and you're getting the runaround, there's pretty good chance that it could be TOS, and you're not going to get diagnosed with it by just going to a neurologist or a general practitioner or even an orthopedic doctor. Most doctors don't know about it, which is a shame, but hopefully that's going to change because some new standards were released this summer, like standardizing the diagnosis, standardizing the definition, standardizing the treatment, and I think that's going to change. That it's going to be on the radar of more people. Right now, basically, the only time you hear about TOS is when a lot of the Major League Baseball players get it, or some other athletes. But yeah, so I think that's going to change in the future. But if you're having symptoms of TOS, just don't waste your time going to people that don't know what they're doing. You have to get to an expert. Now, I'm in the United States, and I'm a patient at Johns Hopkins. My surgeon is Dr. Yingwei Lum, and he is absolutely amazing. The care that I get there is so good, and he's given me my life back. I don't know what else to say. Like, if it wasn't for him, I don't know what I would have done. Like, I have my life back after years and years of horrible pain. So Johns Hopkins has an excellent TOS clinic, and it's a high volume clinic. They do high volumes of surgeries a year, which is very important. So you need to get to a place that does high volumes a year and is very good at the surgery, and can diagnose it. So like I said, there's Dr. Lum at Johns Hopkins. Another East Coast doctor is Dr. Dean Donahue at Massachusetts General. He is supposed to be absolutely excellent, and he handles a lot of the really complex cases and a lot of the redo operations, because if you get a surgeon that doesn't know what they're doing, they can really screw it up. And I have quite a few friends that have been permanently injured by doctors that don't know what they're doing, and that's unacceptable. But hopefully that will change too in the future. But anyway, so Dr. Lum, Dr. Donahue, on the East Coast as well, down in Florida, Dr. Carl Illig, and he was the one that headed up the new standards, that, all the bigwigs got together and, published the standards. So he's down in Florida. Dr. Pearl is another good one in Texas. I'm not exactly sure where he operates out of, but he's by all accounts very good. Dr. Freischlag out in California, she's at UC Davis. She trained my surgeon, and she is an amazing researcher too. When I became diagnosed, I just got my hands on every bit of research, and she has some really good research. And another one is Dr. Thompson in St. Louis. And you see him a lot in the news. He does a lot of the ball players. So don't waste your time. Get to one of these people if you're having these symptoms. A lot of patients have to travel to get proper care. That's sad, but it's better to travel to get proper care than to either suffer for years and years and years, or have the surgery done poorly and be permanently injured. So TOS is a horrible, horrible condition. I would not wish it on my worst enemy, but one of the most amazing things is the friendships that I've developed from having the condition. I've joined some of the Facebook support groups for TOS, and I have just met the most amazing people. Some I've met in person, some I just talk to regularly within the groups or within private message or text message, anything. But I have, gotten the most amazing support and developed the most amazing friendships, and that's made all the difference in the world too. So I think, this video is, okay, I've been talking for 35 minutes now, which is longer than my last video. I was hoping this would be like a little 5-minute one. No, I can't. I can't be concise, evidently, but so I think, yeah, I think I kind of overviewed it a bit. Hopefully, this is helpful. Sorry that it's so long. And feel free to reach out to me. Um, you know, I give out my contact information pretty easily. If you have questions, you know, I try and make myself really available because you know, what happened to me was horrible enough, and I just want to be able to help other patients with it. So feel free if you have any questions. So yeah, hopefully this helps. Sorry that it's longer than the last one, but yeah. Okay, thanks. Bye.